My name is Aldo and I'm a radiology resident in Mexico City. I studied there and I am right now in the Imaging Master of Science program. And what I can tell you is that I chose this program because I am very interested in medical imaging research. Where I come from, the research opportunities are not very well developed, and I think the research in imaging, for example in radiology in my field, it's very limited where I come from. I think we only have the basic knowledge, but I think we should have more information about how the images are acquired. For example, how to learn more about the physics, and well, some of the doctors, we're not very accustomed to the physics and the science beyond imaging. So I would recommend this program to, for example, doctors or researchers, also radiographers and sonographers as well, if you have an interest in research in medical imaging. Well, I would like to get the basic skills to, for example, assess a whole research project. If in the future I work at a hospital, I would like to be a consultant, for example, to manage a good project, because the main reason to do research is to solve a problem. So in order to do that, I have to have the clinical knowledge and the scientific knowledge as well. And that's one of my first aims in this program. Well, the first two courses I took were Techniques and Physics and Clinical Application. Techniques and Physics was a very complete course. There I learned a lot about the physical background of every imaging technique, and I think it's one of the most important courses, because if you understand the basic knowledge of each imaging technique, you're going to understand all kinds of research applications, for example. And the other one was Clinical Applications. For me, that was like an introduction course to basic radiology. And although I'm a radiology resident right now, I think it's useful to people, to other kinds of professions like sonographers and radiographers as well. And right now I'm finishing Practicalities and Safety and image interpretation and evaluation. And for example, Practicalities and Safety, I think that's a necessary course, because you're going to learn about how do you get the permission to do research, how do you ask the patient, how are you going to manage their information, is it private information, how are you going to keep it safe, and that's very important. And the other one, like image interpretation and evaluation, one of the most important things that I think it's at this course is that you learn that having clinical background, for example from an X-ray or a CT scan, is one of the most important things for the interpretation of it. Having the clinical information is going to give you a better accuracy for your diagnosis, and I think that's very important to radiologists.